Hello, we're going to be talking about a study that came out within the last couple of years. It's really important because it's showing that women in the United States that are dying of neurological diseases has increased 663% over the past 20 years. This is very, very alarming. And many of us that suffer with chronic disease, especially the different types of neurological diseases, we really want to understand why this is happening. Why is there such a dramatic increase? So I'm going to be sharing, we're going to be creating a podcast, not a podcast, a blog with this topic. And in that, I'll be sharing the link for the study so you can read up on it yourself. But basically, this is a study. They looked over 20 years, and they found that when they compared cancer, and they also compared with cancer and neurodegenerative diseases, but also cardiovascular disease, they found that women dying of neurological diseases in all 20 countries increased significantly over the past 20 years. But the biggest difference was in the United States, where there was almost a 700% increase in deaths due to neurological diseases in women. So my name is Pam Bartha. If we haven't met yet, I help people, I teach them how to live disease-free. I myself was diagnosed with multiple sclerosis 29 years ago, long time ago. And so it is my passion to help to educate people, to help them to see that we do know what causes disease, and there are answers, and there is hope for all of us, that we really have to understand what's going on in the world. So with this study, what is so incredible is they looked at a lot of different factors, and they considered, things like maybe we're diagnosing these diseases better. And they also looked at, well, these are diseases of older people, of the elderly, and I'm getting up there too. And they looked at a lot of different parameters, and they said nothing really is helping to explain such a significant increase in deaths due to neurological diseases. So this would include things like Alzheimer's and Parkinson and MS and all kinds of neurodegenerative diseases, ALS, etc. So why such an increase in deaths caused by neurological diseases when we're seeing that cancer rates are going down a little bit, deaths due to cancer, and also cardiovascular disease? Well, we're going to talk about that today. So if you know somebody who is suffering with chronic disease, maybe some type of neurological disease, please make sure to share this video with them. And please interact with me. Please put your questions in your comments and give me a thumbs up if I say something that really relates to you. But we're really helping to dissect this information and start to discuss and talk about why this is happening, because it is not a mystery. So this is a 2015 study. It is fairly recent. And I just wanted to just mention that, in my reflection of this study, what I really want to talk about is, what I see, because I've been coaching hundreds of people over the last few years. And why are we seeing, thank you so much for all the love, really appreciate it. Why are we seeing such a rise in chronic disease? And why are so many of us, it's not just us that are in our, the baby boomers, but we're seeing younger and younger people coming down with neurological diseases. Well, I teach basically that, just want to make sure, yeah, you guys can hear me. I teach that when we have a disease, there's always inflammation involved, and this is proven by the research. So all diseases include inflammation in the body. But the doctors and the researchers, a lot of them say, we don't know what's causing the inflammation. It's a mystery. So with all of these diseases, including cancer and heart disease, all of the diseases, there's a couple things in common. We still don't know what causes it, and there is no cure, according to our standard of care. But when you actually start stepping out of standard of care and you start to do a little bit of research and you follow different hero doctors and researchers that are thinking out of the box. I'm going to be referring to Dr. Perlmutter a little bit today, because there's a really great video that I'm going to be sharing with you also in a future, probably underneath the blog post. I'll be putting a lot of these resources, and that'll be on our Live Disease Free website. And really what he's talking about is, and I love it because he talks very candidly about the microbiome and the microbiota and how that is so involved in chronic disease. And what that means, the microbiome is basically all the different genes involved in the microbes that are living in our body. And the microbiota is all the microbes that are living there. So they're kind of the same. One's talking about the genes of the microbes, the other is just talking about the microbes themselves. So we know that what is true is that in this day and age, we still don't know what's causing chronic disease, and there is no cure. But we know there's always inflammation present. And with that inflammation, the hero doctors know that it is caused by infection. And it is the immune system's response to trying to fight infection. It is the war zone where your immune system is fighting infection. And so there's tons and tons of evidence showing that there are chronic silent infections in the body that are causing all the different types of chronic disease, including the neurodegenerative diseases, where we're seeing such a spike in all over the world, but also really high in the United States. I didn't get the stats for Canada, so I'm not sure where we stand. I'm sure we're very close with our neighbors. And so really the key is if we know that infections are causing the chronic disease, then what we want to discuss and talk about is how are we getting these infections? Like, what has changed over the past 20 or 30 years? Well, I can tell you that since the 1940s, we have been using antibiotics a lot. And so now we have at least 4 or more generations of people that have used antibiotics. So my mom used antibiotics, and I've used antibiotics, and my children, some of them have and some didn't before I learned how to reverse chronic disease and how to make them stronger. So my youngest son has never been on antibiotics, but my other 2 were on once or twice, but not very often. So the key is that but for most people, even going to a dentist, they're prescribing antibiotics. And there is no greater factor that will really change our microbiome versus antibiotics and some other medications also. So the antibiotics are really the biggest factor that changes our natural defense, our ecosystem, the quickest. And so over the years, since the 1940s, we've been using antibiotics and using other types of medications that really change our microbiome. And we didn't know, the doctors didn't know. So then you add on to that our North American diet, where we're eating more and more processed foods. So the researchers in this study, they really believe that it's environmental factors that are affecting why there is such a huge spike or increase, like almost 500% increase in the United States in deaths due to neurological diseases in women over the past 20 years. Really, really shocking. So number one, the antibiotics and certain medications really devastate our natural defense, wipe out a lot of our good microbes in our gut. And then the bad microbes start to grow, and we feed them with our highly processed diets. And then there's lifestyle factors. Sometimes we're under a lot of stress. Sometimes we're not getting enough sleep. Sometimes we don't take care of ourselves. We're not exercising. All these different things will allow the bad microbes to grow quicker versus somebody who's really taking care of themselves and has a healthy lifestyle. And then there are other things in our environment. Mold. If you live in a moldy home or if you work in a moldy environment, that will also produce a lot of mycotoxins in the air that you're breathing in, which are very, very devastating to our immune system. It causes our immune system to be suppressed, and then we end up with infections growing, and sometimes we can have a lot of mold issues and fungus issues in our body, and that'll be part of the chronic disease infections that we're dealing with. So then there's also been a huge change in heavy metal exposure in our environment. So many of us are exposed to heavy metals and through all kinds of different sources. And I'm not going to go into those now. I've talked about those in past videos if you want to go back and watch them. And so when we have a lot of heavy metals in our body, we become a breeding ground for these infections. And if some of you haven't met me yet, I have a 5 or 6 part series on MS and infections. Go and watch those on YouTube, Live Disease Free on YouTube or on Facebook. And you can go through, and I talk about bacteria and fungus and worms. You actually can see some of the ones that my students are passing. So the mold, our lifestyle, and antibiotics, and then we talked about the heavy metals, And then something that's quite new is the EMF and RF exposure, and they talk about that in this study. So over the past 20 years, there's been a really big change in the amount of wireless radiation that we're exposed to. So we all have computers, and we have cell phones, and we have routers, and there's all these smart meters attached to our house, and all these smart appliances in our home. So the amount of wireless radiation is increasing significantly, and they're saying that is something that is measurably changed significantly in our environment. And I wonder if that makes a difference in, you know, the infections growing faster and resulting in more neurological diseases. And the answer is yes. Dr. Klinghardt has measured this in his lab, and he's found that ambient radiation from wireless devices in a lab setting will actually make the microbes grow. They've grown them on cultures up to 600 times faster. 600 times faster. So it aggravates these infections, and it makes them more virulent, more disease-causing. They produce more poisons, and they grow more quickly. So there's all of these different factors. And then there's another one that's really, really big, and maybe you've heard of it or maybe not. There is a pesticide called Roundup. The active ingredient is called glyphosate. And my dad used it a lot when I was growing up. He was a farmer, and they told all the farmers that it's safe, you can drink it, it doesn't do anything, it just disappears, it dries up on the plant. And then over the years, and this is, you know, correlating again with the increase in neurological diseases and autism and everything, but they've started to study. There were a lot more independent studies done. So some good experts in this field would be Dr. Huber from Purdue University. He's got an excellent video on YouTube. Go ahead and watch it. And then there's also Dr. Stephanie Seneff, and she has a lot of, she's an MIT professor. She has a lot of great information on glyphosate. And then Dr. Zach Bush, he talks a lot about the effects of glyphosate also. All of them are talking about how glyphosate, the active ingredient of Roundup, it is devastating to the lining of our gut. It creates a leaky gut. It really compromises the tight junctions. So normally there's cells that line our intestines that are really tight together, and it prevents different types of foods and microbes, etc., from crossing from our intestines into our body. But when we have glyphosate present, it actually causes, it compromises. So we end up with leaky gut. And what's really fascinating is that with certain different conditions like Alzheimer's and ALS and I don't know about Parkinson's, but for sure autism, and also severe depression, they're finding that in the blood, they're finding these LPS, so they're lipopolysaccharides, basically little molecules that are supposed to be attached to the surface of bacteria in your gut, and they're finding a lot of these in the blood when they're not supposed to be. There's supposed to be a barrier that keeps them out, and they can cause a different, like an immune response with cytokines being produced. So that is very interesting. So we're having a leaky gut in certain conditions, and which they really feel that glyphosate is a really big part of it. And you can avoid genetically modified foods, but it's not just the genetically modified foods that are causing the problem. There is a growing number of farming practices, for example, in ripening crops, where they will spray a non-GMO crop like wheat to spray it with glyphosate to make it ripen quicker so that they can harvest it and it's all ripe at the same time. It basically kills the crop. And so we're getting residues of glyphosate on many, many, many different foods that you would not even know that, because they're not genetically modified crops. There are hundreds of millions of pounds that are produced and distributed in our environment. So it's everywhere. Like Dr. Huber would say that, you know, it's on your driveway, it's everywhere. So really, if you've got Roundup, don't use it. Don't use it anymore, don't put it in. And actually, when I was at a workshop last fall at the ACIM conference and Dr. Klinghardt spoke, he was saying how there are I think that there's a lot of lawsuits coming out, and the companies are kind of dropping this product because of the toxicity. So it's devastating to our immune system, devastating to our gut and to our gut microbes. So it's causing gut dysbiosis. Glyphosate is all on its own. So there are so many factors that we didn't have to worry about 50 years ago that are affecting us and affecting the microbes that live in our body. And what we see is that, for example, with, I'm just going to share some research to kind of link the infections together with the neurological symptoms. So we know that, for example, Dr. Alan McDonald, an amazing pathologist back in the 80s, he found that when people have, Alzheimer's disease, when they have Alzheimer's disease, he can find a lot of Borrelia in it's called amyloid plaque. So when people have Alzheimer's, they have this plaque in their brain, and he's finding a lot of Borrelia, which is Lyme disease, in around the plaque area. What's so fascinating is that Dr. Perlmutter was sharing on one of these videos is that plaque, that substance that is present in the brains of Alzheimer's patient, that is the body, it's trying to protect itself from infection. Because it's called beta amyloid plaque, it actually is made up of this antimicrobial substance. So the body senses and knows that there is infection in the area of the brain there, and so it's producing this antimicrobial substance to protect the brain from the infection. And we're trying to use drugs that are trying to stop the production of this amyloid plaque, which actually makes the patients worse. So he's like, the body is putting it there for a reason. It's not the problem. We have to look at infections. And he was also sharing how none of the Alzheimer's drugs work. And actually, it's heartbreaking because I know people, family and friends that have had Alzheimer's that have used these drugs, and devastating, suffering terribly with them. And apparently, according to Dr. Perlmutter, and you can research this yourself, that the Alzheimer's drugs do not slow down the progression of losing the memory with Alzheimer's and dementia. They actually speed it up. So people that are taking the drug, they are actually worse off than not taking the Alzheimer's drugs. He said none of the Alzheimer's drugs work, and one of the big pharmaceutical companies is backing out. They're saying, we're not going to be involved with these drugs anymore, probably because they're not working, and they probably don't want to have legal problems with that. So devastating. So $1 billion a year spent on these drugs, and they don't work, and they actually make people lose their memory quicker. Really, really heartbreaking. So you can see that all these different research, that's what I'm doing, is I'm connecting the dots for you. So for example, with Alzheimer's, they're seeing that the amyloid plaque, it is made up of antimicrobial substance that your body has put there to protect itself from infection. We know that with Dr. Alan McDonald, what he found 20 years ago, back in the 80s, he found that there is the presence of Borrelia. There is lots and lots of other research. I've got studies together for Parkinson's and the ALS about the leaky gut. So you're starting to see like, oh my goodness, they're all kind of the same. It's just that which microbes start to grow, where they like to live. If they move into the central nervous system, for example, with multiple sclerosis, we know there's tons and tons of studies that I've put together for you showing that MS is caused by infection. So that is on the Live Disease Free webpage, livediseasefree.com/MS-infections with an S at the end. So livediseasefree.com/MS-infections. And you will actually see the link to Dr. Alan McDonald's presentation there. Make sure to watch it, and it would be lower down on all the studies when you get to the parasite section, where they are finding, he found when he looked at the brains and the spinal column, the spinal fluid and brain of 10 people that have passed away from multiple sclerosis, he went and got these from brain banks, he found that they were all full of these little parasitic worms. Full of little parasitic worms, and you think that's crazy. So veterinarians have known for 100 years that when these worms live in the spinal fluid of animals, domestic animals like horses and dogs and cats and sheep and goats, they have symptoms identical to multiple sclerosis, right? So this is crazy. Why wouldn't they make the link? Why wouldn't they? That's the key. And again, what Dr. Perlmutter is saying is that to treat the gut, they're finding that treating the gut, that they have so much improvement with many neurological diseases. Yes, we do probably have to, by the time we have had the disease for a long time, these infections become more populated in the spinal fluid, the central nervous system, the brain, and yes, it's more work, but the key is to turn it around quickly. So I have just shared with you, like, there's tons of evidence showing MS is an infectious disease. And I've just shared with you some different things from Dr. Alan McDonald and Dr. Perlmutter. And also he was talking about, on that same interview, he was talking about fecal transplants, how much they're improving people, children, adults that are dealing with autism and Alzheimer's and all kinds of different kinds of conditions. So there is so much evidence. If you're dealing with chronic disease, what you want to do is you want to take your disease label and go on to PubMed and type in Alzheimer's infection, Alzheimer's silent infections, Alzheimer's chronic infections, Alzheimer's fungus, Alzheimer's, or whatever your disease is, MS, Parkinson's, ALS, and there is a growing body of research showing that. So could it be as simple as that all of these deaths, these huge increases in neurological deaths, are just due to a huge increase in parasitic infections and fungal infections and possibly bacterial infections that are really, you know, at certain ones, right? Certain ones are causing certain symptoms and live in certain parts of the body. And the answer is yes. Why do I know that? Because that's how we're recovering. We're treating infections and we're turning it around. And really there's this storm of circumstances in this world today where we're using antibiotics too much. We still are, you know, a lot of people go to the dentist and they are put on antibiotics after. They get a sore throat and they're still put on antibiotics. So the antibiotic overuse for sure. And then we look at the in our environment. So the glyphosate definitely has been really causing a lot of leaky gut. This whole radiation, I want you guys to start learning about it and start to reducing it in your environment. We are moving to 5G, which is much stronger. It is going to be on every block and a half on a power pole. And it's only a little, you'll see it, it's only about a foot by a foot little box very often. So we are bathed in this radiation, which makes the infections grow quicker. The nice thing is when you learn all of this, you can take back your health. You're not going to be a statistic. You're not going to be one of those, the 663% increase in death for women especially. And yes, men, there was an increase in death due to neurological diseases in men also, but not quite as high as women. So the key is that if you don't want to be a statistic, if you want to live your best life, you have to, number one, be the director of your health. You have to learn these skills. You have to learn how to take care of yourself. And if you are sick, you have to learn how to treat these infections. That's the only way you're going to get better. Diet and exercise are not enough by the time you have chronic disease. Yes, it's super important to exercise. And yes, when you do aerobic exercise, it increases this brain hormone, which is so exciting. It's BDNF. And if you do at least 20 minutes of aerobic exercise, at least 5 times a week, you increase the BDNF, you can actually grow new brain cells. But you first have to get to a place where you can do aerobic activity, right? You first have to start treating the infections, feeling better, improving your mobility, and then taking back your brain. Really important. So what can you do if you are in that situation and you're like, I have a neurological disease? So obviously if more women are dying of neurological diseases, then more women are being diagnosed with them. And how can we turn it around? If you are brand new diagnosed with any of these chronic diseases, make sure you treat it right away. It will save you a lot of time and pain and agony. But number one is you have to stop feeding the infections that are making you sick. Then you have to support the body. You have to build it up. And that includes cleaning up the environment. then you have to go to work and you have to treat these infections. And very often we're seeing that herbs on their own are not enough. We have to use a combination of drugs, just like antiparasitic, antifungal, etc., and the herbs and oxygen therapies, layering on therapies to recover. So that is really the key. So if you are looking for a plan, because most people don't figure this out, make sure to watch my masterclass training that I have. It's called How to Recover from Multiple Sclerosis Naturally. It's not just for MS. I just attract a lot of people that have multiple sclerosis. So make sure the link will be in the feed of this video. Make sure to watch it and you can actually become a wellness champion right away. I just want to say hello to a few people and see if you guys have any comments. Hi, Serapha and John, and antibiotics. Yes, I didn't even mention that. Thank you, John. There are so many antibiotics, like not just that we're prescribed. All our animals, not all, but quite often the agricultural animals are fed a lot of antibiotics, and even in their food. It's everywhere, industry, everywhere. So this is really, that's one of the big factors that's devastated our microbiome. So there are multiple factors that have brought us to this place, but we can turn it around. We do not have to continue to go with that. And then hi, Elvia, and hi, Paris, and Denise, and John, and Lana, and Harry. Hi, Danielle, Anthony. Hi, Mohammed. Stephanie. So, okay, if you still have a healthy lifestyle, are you going to die of something? That is such a good question, Stephanie, because it's more than just diet and exercise. Like when I was young, I was just 28 years old. I was slim. I didn't have as many wrinkles, but I looked very similar to now. I've been active all my life. And I went from being an active, healthy person to having this chronic disease. And so you have to learn how to manage the microbes that live in your body. And as we age, as circumstances happen in our life, and we've been on antibiotics and we try to eat healthy, but it's really a lot of those factors I shared, the microbes become really out of balance in our body. And many of us, including myself, I did not know what it meant when I was constipated, when I had some gas or bloating, or stomach aches, if I ate the wrong foods and I'd had stomach aches, or I had insomnia, or when I was raising my kids and I was a little more tired. Thank you for all the love and all the hearts. So that is the key, is that's what's missing. And you know, we are so focused on eating right and exercising, which is good, absolutely. But there are so many different diets out there, and how do you know what is the right diet? Well, it's the one that feeds your body but does not feed those infections so much. That's really the best diet. So when you really understand how to manage the microbes in your body, then you can find the right eating plan. Then you can implement the right strategies. Then you can make sure to knock back the bad microbes far enough that you can have a beautiful, long, healthy life and die of old age instead of dying of a horrible disease. All right. And yes, you know, we are all going to die. Absolutely, Stephanie. But the key is to have quality of life. And so for myself, you know, I was diagnosed at 29. So if I had not done what I did, I probably would not be alive today. So would I have had my third child? Would I have been able to be a grandmother? Would I have been able to enjoy my beautiful family and to help all these people? So this is, yes, God gave us health, but there are just so many circumstances in this life today, in our environment, that are robbing us of our health and the life that He has for us. Absolutely. Hi, so that's Mike, not Marie. Hi, Mike. Hi, John. Dental health, yes. So John is talking about dental health. So these infections, they don't just live in our central nervous system, but we can have them moving into different parts of the body. So some people might have arthritis and they'll move into the joints. Some people, we can have dental infections and we can end up with the infections moving into our jaw, trigeminal neuralgia. We can have it in our brain, we can have brain tumors. That is an infectious disease. We can have all these neurological diseases. Women, we can have lumpy breasts. We can, we can have cancer. There's, fingernail, toenail fungus everywhere. And so this is really like, taking an inventory of how many symptoms you have, how out of balance are you? And if you don't correct the balance, if you don't bring up the good microbes and bring down the bad microbes, then you hit the brick wall like I did with chronic disease. And that is no fun. It is very expensive and very painful. And many of you know that you've been dealing with chronic disease. And hi, LaDonna. Hi, Jose. Oh, that is, I think, Joseph. Hi, Maureen. Hi, Dan and Teresa and Neva. Mohammed, your book, awesome. You just got my book. You haven't read it yet. Oh, I wanted to say too, I actually was just on Know the Cause, recorded just at the end of 2018. So you'll be able to watch it. It was this Tuesday? No, last Tuesday. I think it was last Tuesday episode on Know the Cause. I had the amazing privilege of being on Doug Kaufman's show, which is awesome. And we will be posting that in our Facebook for sure. Hi, Kenzie. Hi, Anna and Stephen. Jeffrey. So I have validated what you've always thought, MS and bugs. Way to go, Jeffrey. And I'm pretty sure you're the one who's just joined us and you're on your way to wellness. Stephen, and hi, Stephanie. And okay, so what I want to leave you with is number one, if you found me for the first time, you haven't met me and you're like, Pam, this really makes sense, but I've heard so many things I don't know if I believe it 100%. Go and watch my YouTube videos. I have so many YouTube and Facebook videos on Live Disease Free. Get to know me. Start to implement what I teach. Start to have symptom improvements. And this is even if you don't have chronic disease, right? This is for health. And what I really hope is that we're going to be working with more and more people that think they're healthy, but just really helping them to prevent chronic disease. It's so much easier than trying to recover. But if you're at that place where you're like, Pam, I have done the CCSVI, I have done the stem cell therapy, I have done tons and tons of vitamins, I've been working with integrative doctors, I've had a naturopath for $1,500 a month for 3 years, and I'm still sick. Then make sure to watch my masterclass training, because what I teach people is to become the director of their health. This is something we should have learned in school. How to take care of your health for the rest of your life. That is the important thing. So number one, if you are sick, it's how to put yourself back in balance, how to treat the infections, how to have as much recovery as possible, which is always more than you realize, and then how to live out a beautiful, beautiful life. And that is what the Wellness Champions are doing. And they are my heroes. They are the trailblazers. They are truly the pioneers that have taken the Live Disease Free Academy. So make sure to watch my masterclass training. It's free. Listen to all the case studies of people that have recovered and also all the steps that we take. And then if you're at that place where you're ready to be a wellness champion, then make sure to join us. You can get started this week to take back your health and your life. And then you don't have to be one of the statistics, that daunting statistic. It is unbelievable, 663% increase in deaths caused by neurological diseases in women in the United States over the past 20 years. And I think when they looked at the 20 countries, it was 143% increase, and the United States 663, huge difference. And I don't know, like as I mentioned with Canada, I'm not sure where we are at. I'm sure that we're probably closer to the United States because we're very similar, like with everything that we do here. So you don't have to do that. And the big thing is too, is that you recover and then you protect your family from this horrible, horrible trend. So with next week, what I'd like to share with you is there's a really cool study that one of my students brought my attention to. And it's a case report of a woman, 53 years old, that was diagnosed with a neurological condition, and they gave her the standard treatments and she wasn't responding. And so then they decided to, I don't know why, but it's probably some amazing researcher, doctor, etc., decided to start looking to see if there could be some pathogens, and they found that this lady had a type of a tapeworm inside of her body. She had higher antibodies for this, and so this is the world we live in, and it's really neat to see this because this is a 2017 study. So they treated her with a simple parasite drug, and her neurological symptoms were gone. So she was having neurological symptoms, inflammation on the myelin sheath of the nerves. So this can be like anywhere in the spinal fluid or with optic neuritis, etc., and it cured her. Amazing, right? And this is the world that we live in. This is where we are at. So it's not just the fungus that's causing this, the neurological symptoms, and it's not just Lyme disease. We're seeing there's a huge parasitic component to neurological diseases. And they can be big parasites and they can be smaller ones. I mean, the big ones are not going to make their way into the central nervous system, but the smaller ones do for sure. So I'm excited to share that research with you, and it will be added onto our MS. I don't know, I guess it's not really MS related, but we'll definitely be doing a blog post on it also. And that is the thing, is you guys have to help us get the word out. The sooner we can get the word out and getting more and more, and that's what we're doing this year, is we're really collaborating with a lot more doctors and labs and pharmacies, and that is what's going to bring change, because right now the doctors we're working with, they don't have a lot of experience in treating parasites. So that's why they love working with us in the Live Disease Free Academy, because we're working with this amazing cohort of 70 to 80 students at a time from over 10, 15 countries, at least 15 countries now. And when you're working with a group like that, you really see what's working and what isn't. That I'm super excited that we're going to have lab tests too. That's what I'm hoping for this summer, that we can start to have lab tests. And the hard thing is that people with ALS, people with MS, etc., it's not always exactly the same infections at the same amounts. So that's why there is always a little bit of adjustments with treatments. And that's why I can't just say, take this and this drug and you're going to be better, because it's not the same for everyone. And I know that because I'm working with all these students. So with that, I'm going to let you guys go. I'll just do a last little quick check to see if there's any last questions here. Thank you. My masterclass training is posted in the feed of this event. Over 2 years, no grains, no refined carbs, John, no dairy, no smoking. Yay, way to go. But your C-reactive protein has dropped tremendously, but you have to treat the infections. The problem is that when you carry this load of infections with you, it's great that you're not feeding them as much, that you're building up your body, but what's really important is that you have to also treat them. And if you treat them, then you can handle the stresses in life, and it's not going to give you a relapse, because otherwise we still get relapses. That is assuming that you have some type of neurological disease. I don't know if you do or not. Hi, Tammy. You just got my book. Your boyfriend was diagnosed with multiple sclerosis a couple of months ago, so he's looking forward to learning more. So make sure, Tammy, that you get your boyfriend to listen to my free training. Make sure you listen to my videos. And if he wants to get well, if he wants to turn it around, and that's the key, is that he's so lucky that he found me this early, because you're just going to, if he follows the right things, if he treats the infections, he can become symptom-free in just a few months, in as little as 3 months or less. But that's only if he's doing the right things, if he's treating the infections. That's the key. The longer you wait, the more damage we have to our nerves. And I can't promise full recovery, but we definitely can stop the disease process, and we can have a lot of recovery, more than we thought we could have. So thank you guys for all your amazing comments. So you had a UTI and you suffer with MS relapses. So Serapha, I'm sorry if I pronounced your name wrong, but there is a better way. You don't have to live like this, all right? You don't have to live like this. You have to take a different path. So remember that all of the neurological diseases, if you follow standard of care, there's no known cause and no cure. But there is plenty of evidence it's infection. You just have to go to work and treat them. I'm so happy that I inspired you to take control of your health, Allison. You were diagnosed with MS 2 weeks ago. Please, please go through all my stuff. you have to treat the infections. You can literally do what I did, and that is when you catch it early enough, you can treat the infections, and then you can close this chapter of your life, bury it, and get on with your life, and not to have to worry. And the problem is too, this is a big thing I want to leave you with. The MS medications, I'm not against medications. So for example, we're using antiparasitic drugs to help us treat the parasites more effectively than just herbs alone. All right, they work more systemically, they're much more effective, they're tolerated better by the students. But the key is that when you look at all of the new MS drugs, they all suppress the immune system. So they either lock your lymphocytes in the lymph nodes, that's where they're produced, or they block your B cells and your T cells from the immune system, or not the central nervous system, so they're blocking them out of your brain and spinal fluid, or they're wiping out your B cells, that would be chemotherapy. And so then you have to think, like, why are all the drugs suppressing the immune system? The immune system is there to fight infections, so obviously they know something that we don't know, because if you're suppressing the immune system, the only reason to do that is, you know, if you're dealing with infection, then you're not going to have the war. But the problem is that is not a good idea to do, because if you suppress the immune system, what happens with the enemy? If you suppress the soldiers, the enemy just takes over more territory. You may not have as much bombing and as much inflammation, possibly, but that again, you'll see. What I see with students, people that I've met, is that they'll put you on one disease-modifying drug, immunosuppressive drug, and then your lymphocytes will be dangerously low. Then they'll move you on to another one, and your white blood count is dangerously low. Then they'll move you on to another one, and you're at risk for this rare brain infection, and then they'll move you on to another one, and eventually you're becoming more and more disabled because you never treated the infections. And then it's chemotherapy. Let's just wipe out all your B cells. And then you're going to be at risk of having pneumonia. And what about all, like, we know that our central nervous system is not a sterile environment. And if you're blocking out your immune system from being in there, you can have brain tumors, you can have all kinds of other infections. So we've got to start using common sense. And that's what I give you permission to use common sense. Please do. It will save your life. You don't have to be, you know, a 10-year student in university to be able to use common sense, to be the director of your health, to take charge of your health. And that's what I helped you with. I'm connecting all the dots for you. So it's like, that makes so much sense. Treat infections, get on with your life, save yourself a lot of grief, and I'll see you next week. So make sure to watch my masterclass training. If you're ready to treat, if you're like, I don't want to go there, I was just diagnosed, I'm not even going to start to, you know, have mobility issues and this cramping and the balance issues, I'm going to treat right now. I do work with people like that too. It won't be like a total breeze, but way easier than if you're sick. So watch my masterclass training. If you're ready, reach out to me. You can start right away. Otherwise, watch my videos on YouTube, and make sure to subscribe to my YouTube video or my YouTube channel, Live Disease Free. And next week, I will be sharing that case study. It is a peer-reviewed study that is just showing you how these, like, tapeworms, I think it's a dog tapeworm, in your central nervous system can cause neurological symptoms. And when they treat it, there's no more demyelination. Crazy. So with that, I'll let you guys go, and we'll talk to you next week, same time. Take care and bye-bye for now.